Thank you so much for joining us. What are some of the common social determinants that we all face when it comes to brain health?
Yes, so social determinants of health are conditions in the environment where we're born into, we work, we play, we age, and these things include factors like education, your employment. It includes things like socioeconomic status, so whether that's at the individual level or the neighborhood level. I broadly think about these as non-medical factors that contribute to your health, and we know that upwards of 70% of our health outcomes are actually related to these non-medical factors.
And what are some environmental and political determinants of health?
Yes, so I think environmental and political determinants of health are very much integrated into social determinants of health, but sometimes people sort of make these distinctions just so that we can be explicit in talking about these factors. So in terms of the environmental determinants of health, that includes things like climate change. We know that pollution is associated with increased risk of cerebrovascular risk factors, increased risk of dementia. We know that climate change is associated with worsening MS symptoms. We know that exposure to lead affects neurodevelopment for children well into their adulthood, right? So we really need to be thinking about climate change and the environment and how that affects brain health. And then the political determinants of health is integral to this conversation because these conditions don't come out from nowhere, right? They don't come out de novo. There are policies that very much dictate these conditions, right? So whether that is policies that have limited investment in poor neighborhoods, right? We know that there have been racist policies that have denied economic investment in Black and brown neighborhoods. We know there are policies that facilitate access to free or reduced lunches for children in schools, right? And so all of these things have downstream ramifications, but they're informed by these policies, and so we have to be very much involved in those conversations as neurologists because they affect our patients. They have these downstream effects on our patients and our patients' brain health.
And how are some communities at greater risk of being impacted by these factors, and what can we do to work together to eradicate those risks?
So we know that there have been both past and ongoing discriminatory policies against certain communities, particularly racially minoritized communities, whether that has to do with policing, whether that has to do with housing discrimination. So because of that, those communities bear the disproportionate burden of sort of these social risk factors. And in terms of what we can do about it, I think we can think about it as individual neurologists, working with policymakers, but also trying to advocate through professional organizations like the AAN or through our hospitals to promote programs that invest into those communities, right? So there are hospitals that can invest in affordable housing, for example, and that's one way, that they can benefit the living conditions of people around those hospitals. And there are so many different efforts that AAN has been involved in, and so we really just need to venture outside of the clinic rooms into advocacy in order to be able to help our patients.
Thank you so much for joining us.
Of course, thank you for having me.